medical field, and all our friends, all our invitees, all our people. We want to say thank you for joining us. We do not take it for granted. We know that I mean, without this, you should be doing something else, but you have, decided to join us, and we want to believe that it is not going to be a wasted time at all in any way. So thank you very much for joining us. We're looking at your heart needs you. Your heart needs you. And we'll be taking it from this outline introduction, the state of our hearts, risk factors for heart disease, also called cardiovascular disease, common complaints of patients with cardiovascular disease, and then we'll look at the challenges. The next episode, we will try to cover prevention and the rest, but this is the much we will the heart, entire human body. It pumps blood throughout the body to nourish every cell, pumps blood and pumps nutrients as well to the body. And it is extremely important that, this job is done. Without it, the body will die. The cells will, die. The, functions of the system of the old being will be at a very, very dangerous, zone. And so out the body to nourish every cell, every organ, everything within us. The heart weighs between 250 to 350 grams and is a little larger than the size of your fist. We've done this before, but for those who are just joining us, if you clench your fist, the size of that clenched fist, just a little bigger than that, that is the normal heart, okay? It is just a little larger than the size of your clenched fist, between 250 to 350 grams. However, when people have heart disease, the heart can enlarge. And by the time enlargement begins to come, by the time the heart begins to get big, things can happen from there, which we do not want. So we need to take care of our heart. Your heart is located between your lungs in the middle, but slightly to the left of the chest. Your heart is located between your lungs, slightly to the middle of the chest. It's extremely important that that is, known to us. Now, the heart is such that, we need to take care of it. It is extremely important for us to take care of because it is an organ that determines life itself. It determines the quality of our lives. It determines whether we're going to move on or not. The quality of life is impacted by the heart. The quality of life is impacted by the way our heart beats, by the things our heart does. That is why we need to take care of the heart. We need to be very intentional about the way we, take care of our heart, the things we do with our heart. The pumping of the heart is called the cardiac cycle, which occurs about 72 times per minute. The range is between 60 to 100 beats per minute, averagely 72 to 80, beats per minute. When it is beating above 100, we say it is fast. And when it's lower than 60, we say it is a bit slow. There are things that can cause that. We're not going to deal with that today. We dealt with it in one of the episodes last year. Each day, the average heart beats about 100,000 times. A healthy heart makes a healthy life, and a sickly heart makes a sickly life. That's why I believe, the Holy Writ says, keep thy heart with all diligence, for out of it are the issues of life. So we need to take that. Keep thy heart. You are the one to keep it. It's not God's responsibility. It's not someone else's responsibility. The primary responsibility is yours. But if there's any issue, you can now, go out, seek help, from doctors, from cardiologists. But primarily, you are the one to keep it. Even when a doctor steps in, if a cardiologist steps in to help take care of your heart, you still have the prerogative. You are still the primary stakeholder to make sure that the things you're told to do, you effect them so that the heart can, beat well. Heart health is one of the most important determinants of the quality of life of an individual, and it impacts on the impact on the heart health begins before the beginning of life on earth. Very, very important. The heart is what this means is this: before a baby is born, the heart has already started working. The heart starts working, about the 21st to 23rd day of conception, even before the woman gets to know that she's pregnant. That is how important our heart is. It starts working about the 23rd, the 21st to 23rd they to know that they are pregnant when they have missed a cycle. All right. And for that to happen, it's usually 28 to 30 days. But 21st day to 23rd day, your heart already starts beating. Very, very important. So our heart really is older than our biological age. That means, that our heart is older than our biological age, and we need to take care of doing well, with regard to heart health. Okay, so this is extremely important for us to note. And there are landmarks with regards to the heart. This is another thing that we need to consider: the landmarks with regards to heart health. Very important for us to know, and we need to be aware of the fact that when we take care of our heart with regards to the landmarks, it gives us better quality of life. And this is something we want everyone to achieve. We've got to achieve this to make sure that, to make sure a very healthy life. That is important to us. Okay. Oh, sorry. So the heart begins, the one of the major landmark, okay, is the beginning of life. Before the beginning of life, during the stage of organogenesis, congenital heart disease can set in. If if the heart does not develop properly, if there are issues with regards to, the conception, with regards to the internal milieu where the fetus is developing, the heart can develop, in an abnormal way. There can be a defect. We call it congenital heart disease. All right. Usually, the layman will say, "Oh, hole in the heart." So if there's a hole in the heart, there's already, an issue with that heart. We want to make sure that that is dealt with. All right. That during the stage of organogenesis, the heart develops properly so that there will be no problem. After birth, our choices and lifestyle, very, very important. Very important. And that puts the responsibility on us. It's our choices, our lifestyle. Then genetic predisposition, family history of hypertension, family history of heart attack, family history of stroke, of this, of that, no family history and all of that. Genetic predisposition is a major, a factor that impacts on heart health. And of course, the last but not the least, aging. As one ages, certain things go on in the heart and it can impact on heart health. Why do we need to take care of our heart? Number one, your heart is the focal point of your health. Very important for us to know. Your heart is the focal point of your health. I've just said that it is the first organ to start working even before the baby is born. And you know what? It is the last organ to sign out. If the heart is beating, even if the person is not breathing, you cannot certify the person dead. If the brain have issues and is not functioning, if somebody is brain dead, it does not mean that that person is dead. That person cannot be certified dead until the heart stops working. So the first organ to sign in is the heart. The last organ to important organ and with focal point of your health is the focal point of your existence. If the heart stops working, that except if it's discovered early and maybe in the arena of those who are trained and they can, if they can do CPR, cardiopulmonary resuscitation, and they're able to, fortunately bring the person back, then another opportunity can be given to the person. But nobody can be certified dead until the heart stops beating. That is how critical your heart is. It is the first to sign in, it is the last to sign out. Heart disease, also known as cardiovascular disease, is the leading cause of morbidity and mortality globally. That's another reason why we need to take care of our heart so that it doesn't come near us. As much as possible, we want to prevent it. 80% of cardiovascular related deaths occur in sub-Saharan Africa. We need to know that. That puts us at risk. Now, 80% of causes of cardiovascular disease are preventable by cultivating healthy lifestyle behaviors. This is another very important point for us to know, which means that a lot lies in our domain. Okay, we can predict, all right, what will happen later. We have the ability to choose, and our choices can impact on our heart health and impact on every aspect of our lives, really. All right, so what this tells us is this: let's make healthy choices. If 80% of causes are preventable, then we can override the 20% that are not preventable. And that is why sometimes somebody is born into a family with hypertension or family history of hypertension or diabetes. It does not mean that that person has to be hypertensive. It can live such a way that he or she will not develop hypertension, because 80% will always override 20%. Heart diseases are responsible for 18.6 million deaths every year around the world. This is very important for us to note, and this tells us something, that we need to take care of our heart. We need to take care of this heart so that there will be no problem with regards to what we do. 80% of deaths are preventable. Very important for us to know. Now, if this is important, then we need to deal with it. We need to deal with it so that there will be no issues. So that there will be no issues with regards to what we are doing. Can you see my slides, please? Just kindly confirm if you can see my slide. Can you see my slide? No. Okay, sorry. I think something just went on with it. It's going to come back now. Oh, sorry about that. It's coming back. So heart diseases are responsible for 80% of, you know, 80% of cardiovascular disease. Okay, it's preventable, and we need to know that. Now, heart diseases are responsible for 18.6 million deaths every year around the world. That's another thing we need to really, really, you know, quickly restore onto us the slides. Risk factors are important. Risk factors are things we need to deal with. Okay. Why do we need to deal with risk factors? If we can deal with the risk factors, okay, sorry. Can you hear me now? The network seems to be an issue. But can you hear me now? Please, if you can hear me, let me know. Okay, sorry for the itch. So, heart disease, 80%, we've talked about the fact that 80% of causes of cardiovascular disease are preventable by cultivating healthy lifestyle behaviors. Heart disease are responsible for 18.6 million deaths every year round, okay, globally. All right. This is extremely important. 18.6 million deaths is not a joke. We need to deal with this. It's actually the leading cause of death globally. That being said, let's repeat it again that 80% of causes of cardiovascular death are preventable by cultivating healthy lifestyle behaviors. Very important. So, what are the risk factors? What are the things we need to look at? We need to, deal with. We need to avoid. We need to contend with to make sure that our heart is healthy, and to make sure that our heart, gets the best out of us so that it can give the best back to us. Risk factors for cardiovascular disease. There are modifiable and non-modifiable risk factors. Let's start with the non-modifiable ones. Race and ethnicity. Black race, blacks are much more at risk of developing cardiovascular disease. So we need to be aware of that, and we need to live, cautiously. Age, as one ages, the chances of coming down with cardiovascular disease increases. Gender, the male gender is more at risk until the female attains the age of menopause. So this is another very important thing. However, there are behaviors that can, make the female to be at risk even much more. If a female smokes, the estrogen protection is cut off, is nullified, and then diabetes also tends to really impact on the genetic factors. So the modifiable risk factors: smoking, diabetes, physical inactivity, obesity, high cholesterol, high salt diet, and the rest. These are risk factors that can impact on cardiovascular disease, and we need to deal with all of them. It's extremely important. Increase salt diet. We've talked about this. We talked about it during the festive period. We talked about it during your heart and you and the rest. Increase salt diet will increase the chances of coming down with heart disease. Intake of increased cholesterol and saturated fats will increase the chances. Obesity, smoking, alcohol, poor sleep. All right, these are things that will impact on the chances of coming down with cardiovascular disease. Also, poor, cooking foods that will not really taking food that are not healthy will impact negatively on the heart, and that on its own can make things to go wrong. So we need to be aware of that, deal with that as much as possible. Very, that is something that we need to be aware of. Our food, our diets, very important. What we eat, we eventually become who we are, so to speak. And so we need to deal with that. Make healthy choices. Very important for every one of us. Modifiable risk factors, very important for us to deal with. And as we deal with them, remember that we said 80% of cardiovascular disease are modifiable. They can be controlled. We can control them. So the increased salt, increased, processed meat, reduce fruits and vegetables, reduce fibers, reduce all grains. These are things that can, negatively impact on the heart, causing, increased blood pressure, increased cholesterol, increased blood sugar, and that can ultimately impact the heart for us. We need to deal with it. Low potassium diet, reduce, vegetables and fruits can reduce, the supply of potassium, and that will impact negatively on there. We've talked of smoking, type A personalities, those that are, extreme workaholics, they don't take break, they have very short temper span, they they will rather do 10 things at the same time. Sleep and rest is not in their dictionary. These are people that are more at risk of cardiovascular disease. The same thing with type D personalities. These are people that nothing is interesting to them. They're lethargic, just live and let's live kind of people, no drive whatsoever. They're also at risk of cardiovascular disease. I mean, physical activity is going to be next to nothing. They indulge in sedentary, lifestyle and all the rest. These are things that we need to deal with. All right. So, what are the common symptoms of heart disease? Let's quickly go through this so that we can have time for questions. Progressively worsening breathlessness on exertion. You're walking, you're climbing the stairs, and you're getting breathless. Sometimes it gets to a point where the person will need to rest. That is, an indicator, okay, that is showing that, oh, look, your heart needs to be attended to. To see the doctor to help you out. Breathlessness on lying down flat is another thing. You lie down flat, you cannot breathe. As if you want to choke and you have to get up. I mean, that for that to happen, that person has moved quite far. All right, and we need to deal with that. Awareness of heartbeat. Your heart is beating, is running fast as if it wants to jump out. Some people say, oh, the heart is beating as if it wants to jump out of their chest. All right, that's palpitation. You need to see the doctor. Chest pain, especially chest pain on exertion. All right, you walk, you do something, you lift, maybe your groceries, and then you feel pain. When you drop it, when you rest, the pain goes down. You need to see the doctor. Easy fatigability, you get tired easily. You need to see the doctor. Let the doctor examine you. Let the doctor, be able to take care of you so that things can go well. Okay, extreme for us to note. Okay, that is something we need to deal with. Common symptoms of heart disease, very important for us to deal with. Very important for us to deal with, and it's also important that we know that the more we deal with these things, the better our heart will be, and the better the outcome for us with regards to quality of life. Very important for us to note. Now, we need to also know that the chances of becoming very, very weak upon little exertion, the person is extremely weak. That is another thing that one needs to deal with. Okay, getting weak on exertion and things go quite, challenging for that person. The normal activity that you will carry out without any issues, now you carry it out with much stress. You need to see the doctor. Okay, like swelling or cough, and cough sometimes the to see the doctor, or specks of blood in the sputum. You need to see the doctor. Fainting attacks, of course, nobody faints and we sleep at home for that day. The person will necessarily know that, oh, he or she got to see the doctor. Exertional leg pain. All right, you walk a bit and then your legs are aching you seriously, you need to see the doctor. Loss of consciousness and loss of function of one side of the body. It is important that we deal with it. This just summarizes the things I've been talking about: irregular heartbeat, chest this discomfort, swollen legs, shortness of breath, and the rest. These are very, very important. Now, there are challenges. When somebody comes down with cardiovascular disease, it comes with a lot of challenges: reduce and compromise quality of life. All right, we don't want that. And that's why we need to take care of our heart. All right, so that our heart can serve us better. Physical, activity is reduced. You can imagine somebody who is walking and is breathing as if he's just finished a 100-meter dash. There is a limit to how far that person will be able to walk. So physical activity will be greatly compromised. Emotionally, the person, will be challenged. I mean, the things you used to do before, you can't do it anymore. I mean, it will be emotionally challenging. So emotionally, there's a lot of, issues that comes in. In fact, it's been shown that those who have cardiac problem, they also tend to have, emotional, challenges, mental health issues, and the rest. Very important. There's social challenges. Person can't go out, begins to withdraw because he knows that, oh, if I go and I begin to breathe, I don't want to embarrass myself. The person's social life will be compromised. And then economic challenges. These illnesses, if it comes, they are very, very expensive illnesses. Heart failure is very expensive. Stroke, management of stroke is extremely expensive. Management of kidney failure is very expensive. All right, we need to deal with all of this to avoid these challenges. Our heart needs us. We need to pay attention to it, and if it's not giving us any issues, good, we need to nurture it so that it doesn't give any issues. Let's take care of our heart so that our hearts can take care of us. We're going to stop here for today. We will continue during the next episode. Thanks for listening. God bless you. So we're going to give room for questions and answers now. We have 12 more minutes. We'll see how we can quickly finish. But before then, host kindly help me to unmute Dr. Donye so that, if he has something to just help summarize. Dr. Donye, you can also help me unmute Dr. Obieli and Dr. Okogun. Doctors, you're welcome. Thank you for joining. So you can unmute them, let them, just put in a word before we entertain questions. Dr. Donye, Dr. Obieli, Dr. Okogun. The moment the host gives you the opportunity to unmute, kindly click the unmute button and then you can just contribute one or two things before we attend to questions. If you have questions, please raise your electronic hand so that you can be given the opportunity to ask your question. Thank you. Dr. Donye, please go ahead.
Okay, sir. Good evening, sir, and good evening to the house. Just a summary of everything we've listened to today. The bulk of them seems to be with our responsibility, basically. And then part of our responsibility is to make sure we avoid certain lifestyles, food as it were, that will actually compromise our heart health. And from what we've heard today, we've heard about eating right, cutting down our salt intake, cutting down use of seasoning is very important, avoiding diet with high cholesterol level, and also making sure we take time out to exercise ourselves. These are very fundamental things that tend to strengthen our hearts. And also for those on medications, it's also important to make sure we take our medications. Nothing will substitute the place of those medications. And it's a two-way thing. On one part, the lifestyle, okay, for those of us that are not maybe hypertensive or diabetic as the case may be, okay, the lifestyle will contribute significantly to the health of their hearts. And also for those of us that are on medications, to also ensure we take time out to use our medications. In as much as we know that it may be a bit difficult for people to take drugs every day, and then forum like this is to help us understand why it is actually important to give attention to our health, and because we are trying to avoid complications. Dr. Olusegun Joseph has mentioned a lot of complications which we would not want to experience, and part of the responsibility to make sure that doesn't happen still lies with us, and making sure we take seriously lifestyle adjustment and also make sure we take our medications. Thank you for this opportunity. Thank you, sir.
Okay, thank you very much. If you have questions, please raise your electronic hand. Doctors in the house, you're free to talk. You can make host, you can help us unmute them. Dr. Obieli, Dr. Okogun, Prof. Agba, you're welcome. Thank you for joining us. If you have questions, comments, things you want to clarify, please raise your electronic hand so that you can be attended to. You can also put questions in the chat box, and they will be attended to. Okay, good evening. Please, can we be free? Yes, the seminar, the recorded version will be posted before the end of today once we have it. Yeah, so if you're on the WhatsApp group, you will get it today. If you're not on the WhatsApp group, you can click the number. You can, chat with the number that will be placed on the chat box, very soon, so that you can be added to the WhatsApp group. So, if you get recorded version. Okay. All right, it seems as if there are no questions today. I guess it's all okay. There are questions in the chat.
I have a question, but I can't raise my hand. I don't know where to raise my hand.
Okay, please go ahead now that you've been given the opportunity. Can you put it down in the chat box? How to raise your hand? If you go to more, then you go to setting, you will see some icons, icons there. You will see how to raise your hand. Yes, Olubode Pedro. Please, host, kindly help unmute Mr. Olubode Pedro.
Next speaker now should just continue or what?
Yeah, go ahead, please.
All right. What happened is that I've been having some pains on my chest for some time. So and I've been to the doctor. What they tell me is that the pains they didn't see anything. But what happened that whenever I have the pains on my chest, I punch my chest till the pains goes off. I punch as in punch with my fist till the pains goes off. Sometimes it just come. Sometimes I might be driving and it will just come and to go down after punching it. So I don't know what really, and it might be in the right or left chest sometimes. So I don't know what can really cause that kind of pains to just pinch me. So I hope it's not heart or whatever issue. So I'm just
on the left or on the right? Which side of your chest, left or right? Okay, Dr. Obieli, do you want to answer that for us? Do you want to help the
sometimes can be right or left also. Is that right or left?
Okay, whether it's right or left, any. Okay, fine. Dr. Obieli or Dr. Okogun?
Hello, good evening, sir.
Good evening. Good evening, Doctor.
It's good to be here. Sorry, last year had a lot of challenges that made it impossible. I hope that this year can do better. I'm not sure of the question you asked. I'm actually with some people. I didn't quite hear the question you asked.
Okay, no problem. We'll go with it. Dr. Odan, do you want to help him out?
Okay. I think it said the pain is either on the right or the left side of the chest, if I got that right. network was a bit hazy at some point. But if that is the question, most of the time, if the number of questions that we need to be asked to start with, so if you tend to actually have the pain which changes with posture, let's assume you maybe bend down, you sit up, you're turning in bed, and you seem to have the pain more. Okay, it might suggest that the pain might be from your muscles and not necessarily from your heart, as it were. Okay. However, for heart-related pains, it might actually start with activity. Maybe when you exert yourself a little and you start to feel pain in your chest, and it may be relieved with rest. Okay, or having palpitations with that chest pain. Okay, or you have difficulty in breathing with that chest pain. So quite a number of things can actually cause chest pain. Okay, ranging from your muscles around your ribs. Okay, the heart itself can be a cause, and even sometimes some patient with ulcer, a spectrum of ulcer, can also make you have chest pain. So there's need to actually sit with your doctor and ask the right questions, and then to look into all the possibilities to look out for what might be the cause. And it's also important to do some heart screenings just to be sure things are fine, which includes your ECG, where some wires are connected to your chest to evaluate the function of your heart, basically. So I think doing some cardiac investigation can help us to rule out if it's cardiac.
Okay, fine. So,
okay, sir. Thanks, sir. Hello, am I audible?
Yes, you are. It went up.
Okay. So I think you just need to actually have a session with your doctor or probably a cardiologist so that you can be well evaluated. I hope that suffice for
the person that asked the question. I guess is Mr. Larry. Okay, thank you very much. So you may need to see your doctor. They may need to help you out with few questions. There are questions we would have loved to ask you, but that would really take our time. So you can either contact us after this time out, or you see your doctor, and he or she will ask you a few questions. But if you hit your chest and that makes the pain to stop, all right, it's very, very likely to be a musculoskeletal pain, a typical chest pain. However, there are questions I would have loved to ask, so I won't just jump to conclusion. You need to see your doctor, let them at least do your ECG, ask you a few other questions. It's sounding like a heart related thing though, but because I don't have the full picture of what you are talking about, and I don't know your risk factor profile and the rest, so that we can further help you out. Yes, Mr. Olubode Pedro.
Hello.
So if you have asked the question in the chat box, please check so that you can get the answer to your question. Please go ahead, sir.
Okay. Well, thank you very much, Dr. Segun. The explanation was very clear. Well, I am hypertensive.
Go ahead, please.
I've been hypertensive, diagnosed with hypertension for more than 30 years. In fact, maybe close to 40 years. So I've been using my drugs. Well, recently, I started having serious waist pain. Serious when I also went.
Sir.
Sorry?
I'm hearing.
Yeah, are you not hearing me? Are you hearing me now? Hello?
Oh.
Hello? Hello?
Oh. You're audible, sir. You're audible.
Okay.
Can go ahead, sir. You're audible.
I said I was diagnosed to be hypertensive, I think about 40 years ago, and I've been using my drugs regularly. But recently, I think last year, I was having serious waist pain, so I went to see a doctor who specializes on arthritis something. So, but the drugs given to me worked, in fact, that very night. But after a week after, I started having the pains again and also getting tired and weak. So even when bathing, sorry?
Yeah,
Hello?
go ahead, please.
Even sunny
Go
bathing, I
ahead.
mean, I'm always feeling tired to bath and say, what kind of a thing is this? So I have been thinking that maybe I should go and visit my cardiologist. So because I don't know whether waist pain can relate to getting tired and weak. So I don't know how you can help me.
Okay, so if you're having waist pain and you're getting tired and weak,
Yes.
definitely you need to see a doctor for them to ask. There are questions I would have loved to ask, but time will not permit me now, so that we can
Okay.
give
Sorry,
opportunity
sorry.
to
Which
other
doctor?
people
I told I've
ask their.
seen an arthritis specialist. Then I don't know whether he's the one
Okay,
I should go back to or to a cardiologist.
for your back pain, you can, still see the arthritis specialist. Is likely to be spondylosis. All right. But for your getting tired and the rest, I think you
Uh-huh.
may need to see a cardiologist.
Uh-huh. Okay.
Especially if it's tiredness on exertion, you will need to see a cardiologist. Yes, sir.
Okay. Okay. Thank you very much. I appreciate it.
You're welcome. Yes, sir. Mr. Femi Oyebanji, please also help me unmute. Please, if you have questions or comments, you can raise your electronic hand so that you can be unmuted. You can be given the opportunity to unmute. Yes, please go ahead. Mr. Femi Oyebanji, you can unmute your mic and ask your question. Any other person with question? Dr. Adesanya Boye. Host kindly unmute Dr. Adesanya Boye. Mr. Femi, you can unmute your electronic mic so that you can be we can hear you. We didn't hear all you said. If you were actually talking, we didn't hear all you said. So please, you can still ask your question. Yes, Dr. Adesanya Boye, you're welcome. Please go ahead.
Thank you. Thank you very much, Doctor, for
Thank you,
this
sir.
enlightenment. I'm very grateful on behalf of other people. Please, I want to know, I've been seeing my cardiologist because at the point in time, my BP was high. After doing what you call it, this test they do. So he now said we need to work on the BP. He gave me a six-week cycle of medications, right? So, but he now told me of a target. On my own reading, maybe my own BP checks, I'm having very good record. But each time I go to the hospital, after this 6 test, and it's always, higher reading. So I've told him the last time, so I'm going to bring my own instrument so we can check it. But majorly, after around 3 rounds of 6 weeks, I found that I have this erectile dysfunction. How do I know? Normally, when I wake up in the morning, I have this sensation of pain. But for now, I don't have it. I went back to him, and one of the drugs was Aldatone or so. He removed that. He said, okay, we can remove that. Otherwise, still there. Is it that BP control can affect erectile functioning? That's the question.
Okay, thank you very much, sir. There are a lot of things that can affect erectile function.
Okay.
Yeah, we can hear you. Are you done or you're still? Are you done? Okay, fine. So there are a lot of things that can affect erectile function. If your blood pressure is not controlled, that can affect it. the diet. I mean, if the person is taking more of saturated fats and the rest, that can affect it. If the person is diabetic, that can affect it. There are certain drugs also that can affect erectile function. Usually, we tend to avoid those drugs, and that doesn't cut across everybody. But for some people, when they take the drugs, they can have erectile function. If they come, down with the complaint, we tend to remove it and put them on drugs, on other drugs. There are other drugs too that can enhance erectile function. I mean function. So we need to know that. Now, with regards to that, I think you will need to see your cardiologist so that he can look at your drugs and then, be able to advise you appropriately. And your blood pressure as much as possible and every other thing that can affect your performance should be checked. If your blood pressure is well controlled and every other thing, okay, exercise will help you out, and taking fruits and vegetables will help you out, and the rest. Those are things that I'm sure that your doctor will be able to tell you about. With regards to your blood pressure higher in the clinic than at home, yes, that can happen. Sometimes the anxiety of, oh, I hope I will hear good news today. I hope they will say this is happening to me and things like that. Those anxiety and things like that can make the blood pressure to go up. However, periodically, I will advise that we change the batteries of our machine, of our devices. If the battery of your machine goes low, all right, it can begin to give you very funny readings. So we need to also, deal with that. All right, I hope that answers the question. There's somebody used it for about a year. However, I do not have any symptoms anymore, and I have to keep taking drugs daily. I have appointment with my cardiologist next month. However, I want to know if I have to keep taking the drugs.
Good evening, sir.
Yeah, good evening,
Good evening,
Doc. Well
sir.
done.
Good evening, everyone. I've been answering all the questions online. So I've answered all the questions as posted on the chat.
Okay, you've answered that.
Right. Yes, I've answered the question.
Okay, thank you very
much. Yes, sir. Yes, sir.
Okay, thank you very much. God bless. All right. Okay, any other thing? I think we need to close now. If there's no other, thank you, Dr. Obieli. We appreciate it.